Hey YouTube, thanks for tuning back in to the Ron Paul 2008 channel's feature on You Choose 2008. Many of you know that Dr. Paul is an OBGYN who's delivered over 4,000 babies. So today, you're going to hear Dr. Paul talk about health care. Check it out.
You're a physician, I think the only presidential candidate on either side that is a physician. So from your perspective as a physician for 30 plus years, what is your answer to the so-called health care problem that we have?
Well, I think we have to reject what we have,
okay.
And most people agree with that. But almost everybody said what we need is total socialized medicine, and I don't like that because it doesn't work. And we've had too many examples of that. I mean, even in a place like Canada, which is not overly socialized, but their system is such where a lot of Canadians have to come to the United States because we have a freer market. But we're undermining it. We don't have so much a government socialized system, but we have a mixture of government involvement with the bureaucracy. At the same time, we've created a corporate-run medical system, which means that the laws in the early 70s, 35 years ago, the laws were changed to encourage tax benefits to corporations and then mandates on these corporations on providing medical service in such a precise manner. And this has done one thing. The most important thing it did was push the prices higher. The inflation gravitated, of course, to medical care. And so this has failed. The costs have gone up. The profits have gone to the HMOs, the PPOs, the hospital management companies, to the drug companies, and on and on. It's undermined the doctor and patient relationship. It's made the doctors upset. They're dropping out of, say, Social Security or the Medicare and Medicaid. They won't take it, and they generally don't like to take care of the military just because too much government involvement. And so the doctors are unhappy, the patients are unhappy, the corporations, as long as they're making a lot of profits, they seem to be satisfied. When the prescription drug program came along, another big entitlement increase by those conservative Republicans, the lobbyists for the drug companies, they came and spent millions, tens of millions of dollars lobbying for that bill. So I reject that system. And I don't support socialized medicine, so what we need to do is continue to move in the direction we're moving in right now. And actually the President's been on our side on this issue, and that is the medical savings accounts. And that is allow people to opt out of the system, legalize freedom of choice. That is, give people an ability to put money aside and get it back from their taxes, a tax credit. If they don't spend the money, they get to keep it. So the incentive is to spend less, not to abuse and say, oh, I can go to the emergency room, I can go see the doctor, it's only going to cost me $10. And they abuse the system. And if you allow the patient to make the decision, he can pick and choose his doctor. He can pick and choose the type of medicine. What if he wants to drift away from conventional medicine, go to holistic medicine? And he'd be allowed to because it's his money. And that's what we need. And we don't have to close the other system down. Okay. We don't have to just turn the key off. Matter of fact, I think what we need is a transitional period where people can make these choices. At the same time, I would tide people over by literally saving a lot of money from this overseas expenditures, enough to even cut the deficit, at the same time not put people out on the streets. But today, because of our foreign policy, here again, foreign policy connected to domestic policy, because we're coming up short with funds because of all this money we're spending overseas, they're starting to cut back on some of the medical benefits. And where are we going to save here? And even though I'm not, ultimately I think those programs need to be phased out, but I'm not for cutting them or slashing them. Matter of fact, I want to work a transition, and you could only do that by integrating these two programs, whether it's domestic or international. And we literally could save money from overseas, cut the deficit, help people who need the health care, and then especially young people to opt out of the system and get control of their medical care once again, and let the doctor and the patient relationship come back.